Okay. Good morning to all friends, wherever you're watching us from. My name is Mr.Selfcare, and I welcome you this morning to yet another full-packed episode that many of you have been asking me about. I've had several questions from a special kind of people in our lives about a special topic, and this morning I decided to invite experts such that we have this discussion. It is a special morning, special Sunday morning, and to the friends that have had a lot of achievements this week, we celebrate with you. To friends that have gone through some tough times, may the good Lord be with you. And to colleagues that are here with us for the very first time, we welcome you in a very special way. This morning on this page, we welcome you, you're our special visitor, and we kindly ask you to subscribe, to share, and to comment. But towards the end of the program, or whenever you feel you have a question, please put your question in the comment section. Today, we want to speak to a special group of people. We want to speak to mothers that are planning to have children. We want to speak to mothers that have had children. We want to speak to first-time mothers that are worried about their sizes or their weight after giving birth. We want to speak to women that gave birth and failed to regain their original size. Between me and you and my management, we know these are one of the topics or questions that they have been asking me ever since we started these live shows. Ladies are telling me, please bring experts to us to explain to us how we gain back this weight. And this moment, we are privileged to have two clinical experts. One of them is a whole doctor, Dr. Sharon Kamba Aine, my great friend for the last 10 years, all the way from Uganda. The other person is a physiotherapist, Dr. Solomon Buwembo, all the way from Chiboga Hospital. These two people, number one, Sharon has walked that journey twice. She's one person that puts on a lot of weight when she's pregnant. But immediately after giving birth, a few months, she goes back that model side. So we just didn't want to bring someone that is going to talk about books, but we brought someone that has walked that journey, a mother who gained the weight and lost the weight. But also on the other side, we are bringing a physiotherapy expert who is supposed to work with these mothers when they go for gym instruction or for physiotherapy session. So it's going to be a mixed session, a packed session, and we tend to cover the following topics. Number one, we are going to look at postpartum weight loss journey because it's a journey. It's not a one-day thing. Number two, we are going to look at best exercises after pregnancy. Number three, we are going to look for health diets for new moms, tips on losing fat belly after baby, managing sleep, stress and hormones, breastfeeding, weight loss, C-section recovery, and fitness. Again, if you're here for the very first time, you're most welcome. But before we go into any other thing, let me introduce my guests to you to greet us, and then we shall pick it from there. Sharon, you're welcome.
Hello, good morning from Uganda. Thank you so much for having me here. Yes, I'm Dr. Sharon Enembawazi Kamba. I'm a mother of two, 6 years and almost 3 years old. I'm happy to be here.
Okay. Dr. Solomon, Mr. Solomon, please greet our viewers.
A very good morning to those in the morning hours, and a good evening to those in the evening hours. A good afternoon to those in the afternoon hours. Solomon Buembo is my name. I'm a physiotherapist, and I actually work, and my entire things is dealing with the mothers postnatally. So I'm glad to be here and to present what the journey is about losing weight and postnatal physiotherapy all in one case. So I greet you all and enjoy the show. Thank you.
Okay. Sharon, again, you are a lady that has gone through this journey. One of the mental health questions that so many young girls are having today, they are worried about regaining their sizes after giving birth. I come from a sports oriented background. And here I have a lot of female colleagues, referees, administrators who are worried even about getting married because they are scared that once they get married, they cannot go back their size or become fit again. As a mother of two, take us through this journey. First, as a mother of two, practically, take us through this journey. How is it achievable? How easy is it? And I mean, how practical is it?
Okay, thank you. So, this is me. Before pregnancy, before marriage, I had this small figure. I was always, looking very curvy, not so big, but yeah, a very portable figure. And here I am. I get married. I get pregnant with our first daughter, and boom, I gained extra 30 kgs. Actually, it was more than 30. Like throughout pregnancy, I exploded my entire body. I just, in the first trimester, I usually don't have appetite. By the second trimester and third, I eat, and then I gain all this weight and I become so puffy. Wow, it's too much for me, but I don't usually mind. I have this baby, and guess what? I'm not someone that has natural breast milk. I struggle with breast milk. That was with my first daughter, second baby. But because I understand the advantages of exclusive breastfeeding, I decided that no matter what, I'm not going to have my baby go on formula, even though I'm very busy. So I eat lots of different things. You eat all this, you have porridges, you have milks, you have literally everything that you are told that it's going to help you gain weight, have breast milk. But of course you don't know what will happen. Eventually I was able to have breast milk and exclusively breastfeed the baby for the 6 months, and I gained so much weight, like so much weight, extra 30 plus kgs I had gained. But because I like how I was looking before, and my body is all this big, and by the way, I also had a C-section. It wasn't a normal. It wasn't like a what we call spontaneous vaginal delivery. It failed and ended up with cesarean section. So of course the healing is longer. Yeah. So after 6 months, now my baby has exclusive breastfed, and I start on my body. I usually start working on myself once the baby hits 6 months, and I know that I start supporting the baby with small feeds. As the baby gets used, that 6 months, 7 months, 8 months, I now reduce on what I have been taking myself, so that I start the weight loss journey. I don't usually go to the gym, but I look at what am I consuming in terms of carbohydrates, fats, proteins, and all these different sorts of food. So through my discovery, I realized that carbohydrates play a very big role in terms of weight gain, and fats. So I cut down. I do a gradual cut down. I don't do sudden, because remember, much as I exclusively breastfeed for 6 months, I still go ahead and breastfeed the baby until when she's like 1.5, 1 and 4 months there. to protect their immunity, protect them. And it's not that they're actually feeding enough, that just the feeds that you have started will protect them. So of course you have to have the baby in mind as well, knowing that she's still growing, or he or she is still growing. So yeah, you support them in that. So I do a gradual reduction of carbohydrates and fats. I stop the milk. If I take the milk, it will be like 1 cup. Porridges, the millets, posho porridge, maize flour porridge, I reduce it as well until when I have small portions. Yeah, and that in these whole sessions, my first baby, I cut 30 kgs within a period when I started like seriously diet control and carbohydrate control. It took me a month with few months of preparation of the gradual cut down. But when I started that, now I'm on a weight loss journey, I gave myself a month, and within that month, with my gradual reduction, I was able to cut down. That is for the first baby, I cut 30 kgs. For the second one, I cut 25 kgs. So I usually gain really so much. Yeah.
Okay. Let us start here. So you talked about weight gain during pregnancy. Can you take us through, as a lady and as a doctor, where is this weight gain coming from during the first or second trimester mainly? Because this is what actually worries so many women about that weight, because many of them will tell you, but I don't eat. Where is this weight coming from?
Usually in the first trimester, you don't really gain that much weight. But in the second or third, the body demand is higher. In the second and third trimester, mainly the third trimester, the body demands 2 times of what you have been consuming. And that means 2 times of literally everything, 2 times of how the heart has been pumping blood, 2 times of the nutrient uptake that you are taking. Literally, it's the physiology. The body continuously is demanding, because you are having this baby who is growing in you, and this baby is also being supplied exactly what you are also receiving. So yes, sometimes you don't notice that you are eating, but any small intakes that you're having actually is taken up, because this body is demanding twice of what you have been having, which is okay. We usually encourage mothers in terms of growth for the baby. It is usually the third trimester actually that is more beneficial, in terms of that's when the baby gains weight. And because the baby is gaining weight in this third trimester, that means that the body is having a high demand in what you are eating. So you find yourself, even if you're snacking, anything that you are taking in, it actually makes the body, like you gain weight, which is natural. It is okay. Like, you don't really have to be worried about it. And even throughout pregnancy, I usually encourage mothers, draw a balanced diet. Ensure that you're having enough fruits, you're having enough, intakes of different proteins, because this baby is growing and they need all those nutrients from the first to third. But in terms of consumption, consuming what you're eating, it usually starts in the late second trimester to the third trimester. Yeah. I've lost you.
So this literally means that the weight gain is normal.
Yes, it is normal.
Yes, Mr. Solomon.
Yes, please.
What has been your experience with the ladies coming to you about this weight gain? Because as a physiotherapist in our hospitals, I think To some of the ladies that don't literally go to the gyms, they always end up coming to you. What has been your experience as a man? Before we go into the exercises, what has been your experience as a man towards these ladies? What stories have they shared with you? What is their fear? I mean, what have you been experience with working with these ladies that want to do weight loss programs?
Actually, when you look at what our mothers are facing, you realize that majority of them get these complaints of weight gain, and majority of them actually lose their self-esteem because when they were before pregnancy, there are people who are reaching out, having all these, then their natural curves, their figures, and now here comes post pregnancy, where now the everything is now in its own way. So mothers want to regain back their sizes, their figures, and I mean they always come to us. Actually, even they get some pains uh, after pregnancy. So in what I've got mainly as a physiotherapist, mothers with pain, back pain, mothers with sagging bellies.
Mm,
So they usually come to us. And then the other thing, what I usually do is that I train them as soon as possible. Yeah, because we have a maternity ward at hospital, so I always go there and give them exercises as soon as possible, such that by the time we reach the after the postpartum period, they can now go ahead and do their exercises and get back to their sizes.
okay. Dr. Sharon,
Yes.
how emotionally straining is it for mothers about weight gain? In your experience as a lady, but also as a mother, but also as a medical doctor, is it something that worries women more?
Well, I would say, from my experience, at first I was worried because I totally became a different person. You are, let's say, 60, 65 kgs, and then here you are 90 kgs. And of course, it's usually gradual. But what helped me not worry and feel stressed about it was my baby was healthy. I was focusing mainly. So I change my mind and narrative and say that, you know what, here I'm having this baby. She is my first priority. Yes, I'm gaining this weight. And initially, it's not healthy weight, uh, because when you look at the pregnancy and how much it takes up, you realize that even when you have gained all this weight within after delivery, it should, like, gradually reduce. But here you're having all this weight coming up, and your mind is really stressed about it because you are looking totally different. But I usually change the mind. From my experience, I change and focus on this little being that I have made. And yes, I've had people ask me, oh my God, I'm looking extra. But I'm always encouraging them that it is okay to gain the weight. Yes, it's not healthy weight that you are supposed to have, because our bodies, one thing that we need to not realize is our bodies are made differently.
Mm,
My kind of body, when you look at me after baby and after losing weight, you don't actually realize that I'm someone that will gain all this weight. But
mm,
guess what? When I get pregnant, the weight becomes unbearable. Even
mm,
after baby, I'm looking totally different.
mm,
So, and then there are those people, naturally, they even eat so much. during pregnancy, and they have not gained so much. And at the end of the day, they have had a normal baby, a normal weight of a child, 3 kgs, 3.5, 4 kgs. You know, they have that normal, that normal. But one, you have to realize that our bodies are made differently. But what you do about it after the baby, when you refuse to stay in that shell of I had a child, let me look at as a child, let me look at as a mother, I'm a mother. Then you start buying new clothes that fit this extra weight that you have gained, and you become comfortable. So my advice with, it's okay if you have followed what your doctor has guided you about weight and pregnancy, and you realize that you are actually still gaining weight. It's okay. But what you do about it after you have breastfed your baby, after you have given birth, is what matters most.
Okay. Okay. So, okay. So, in other words, Dr. Sharon is actually telling us that you're telling us that first of all, it begins with accepting as a mother. And you say, this is what I have, this is who I am, and then you look at the baby as the most important thing. Because I work in the radiology department, and one of the question that actually women were worried about was weight gain and how they were able to shed off this weight after birth. But Dr. Sharon is telling us that during pregnancy, let's forget about the weight you are accumulating and focus on the well-being of the baby. Because like she said earlier, this baby is feeding on you, is relying on you. So it is literally two people eating in one thing. Before I go to Dr. Solomon in a minute, you said something very important. And actually, I always had a question on. So, Dr. Shan, you're trying to tell us that some women will accumulate too much weight, but literally their baby is small. And some women will literally change in no size, but their baby actually has more than enough weight. Does the increase in weight of a pregnant mother directly proportion to the weight of the baby to be born?
It really depends on what, just like the way how I can say the physiology of
Yes.
pregnancy and how it's made up. If you are consuming more fat,
Mm.
you are not having a balanced diet,
Mm.
the body will pick out what is needed for the baby. If you're having one type of diet and you are leaving out the rest,
Mm.
carbohydrates, especially carbohydrates, the baby is not going to be given just carbohydrates that you have consumed. No, those carbohydrates, those are the extra, you know, fats that are going to be just deposited on your body. So what happens is the body will break down all those carbs and they just pour them, around your belly, around, some people they gain around the cheeks, around, but mostly around the abdomen. So you'll find that you are gaining all this weight, but it's not that the baby is going to gain all that. You have not given your child a balanced diet, so they are not going to have that in them. But you yourself are going to be consuming all that.
Okay.
So yes, so you can actually, when you are not taking in the proper balanced diet, you are going to have all that accumulation, but it doesn't mean that the baby is going to consume that. So I would advise a balanced diet.
Very
Even when,
important. Literally, you're telling the mothers watching out there that you can take too much, you can eat too much, but literally the baby is not picking anything because you're not giving the baby what it wants to feed on. For
yeah,
example, it's like putting so much feeds in a farm, but literally you're putting what the animals do not want to eat.
yeah,
Okay, so mothers out there should strike a balance between eating what they want and what the babies want. So it takes us back to the role of nutrition actually in pregnant mothers. We are going to be having a nutritionist, Dr. Marka. I think next month we are going to have, every month we are going to start an episode on nutrition, because we feel that is something very important to do. Dr. Solomon, over to you. Dr. Sharon has talked about and given us a personal experience about this weight loss journey. I now come to you as a physiotherapist. What are some of the best exercises for mothers to have after birth? And in your explanations, can you clearly tell us exercise suitable for mothers that have given birth through spontaneous delivery, and then versus those ones that have used C-section? Because this is where we are having a lot of misconcept communication. To some mothers that have gone through C-section, some are saying, oh, the doctor said I should not do any heavy exercise. So they stay there with their weight and they do nothing about it. To some others, you find them a few months after their birth, the moment the wounds are healed, they want to go to the gyms and lift. And now we are having a problem of unprofessional people managing the gyms. And because of that, we are having mothers having complications after C-sections. As a specialist, take us through the best exercises after pregnancy.
Thank you so much. I love the fact that these exercises are done differently with the different mothers. The exercises that are done by cesarean section mother are not the same as those with the NVDs or the spontaneous or the normal delivery, how people love it. You realize that the protocols that we follow during or when handling a mother who has undergone cesarean section are pretty different from those that undergo normal delivery. Now, let me start with those with the normal delivery. Now, exercises. Let me also tell people that exercises are done.
Dr. Solomon, before you proceed, I've been close to women that went under C-section. When you say normal delivery, to some of them it's an insult.
Oh,
Yeah.
All children are born in normal, so we don't have
my
abnormal,
apology.
and
My
so
apology.
we
I
shall call
withdraw
it
that.
spontaneous vaginal delivery and then C-section. Thank you.
I withdraw that. I withdraw that. Apologies. So, back to the exercises. Those who undergo the spontaneous vaginal delivery, we always look at them. One, before I go to the exercises, I wanted to pass this. Exercises are started at least 24 hours after birth, whether
Okay.
it is cesarean section or spontaneous vaginal delivery. It is that the thing that changes is that the intensity is the one that changes, because exercises are required as soon as the baby is out, whether it is C-section or spontaneous vaginal delivery. So, for the spontaneous vaginal delivery, what is it that we look at? Number one, we want to look at the muscles of the belly, we want to look at the muscles of the back, we want to look at the muscles of the lower limbs, and then correct positioning of the mothers during doing their chores, and then also breastfeeding, because you realize that positioning has actually caused the different things and matters concerning our mothers. So, number one, exercise. We always want to do breathing exercises. Breathing exercises, in this case, we always look at the diaphragmatic breathing. What does this mean? When you look at a mother in the third trimester, there the baby is it has grown in size, and when you look at their position, in other words, we look at the lungs being compressed, because as the baby is growing in the uterus compresses the abdominal contents, who also compress the thoracic contents via the diaphragm. So we want to look at the diaphragmatic breathing. In this case, what do we do? You take in you lie, of course, lie facing upwards on a flat mat, yoga mat, name it. Then you put one of your hand on your belly, and then you breathe in. So as you breathe in, you look at your chest increasing in size, and then your tummy or belly also kind of pulling wide. In other words, you're looking at the diaphragm. Diaphragm is that muscle that helps us in breathing, but it's just below the rib cage. It actually gets a boundary between the rib cage and the abdominal area. So that muscle there is what we always need to move as much as it can, because it has been compressed during pregnancy. Now we want it to be free. So that's exercise number one. Exercise number two, what usually doctors tell our mothers to do, is walking. Walking is very good for our mothers. Now, we may not be able to do the brisk walking as, because still have some pain. The physiology is not yet back to the non-pregnant mother or any other person who's not pregnant. The physiology is just returning back to normal. So we have to see them walk, but not that brisk walking. So at least the mother should take at least a 10 minutes walk, morning and then evening. Then the other exercise that we always want our mothers to do, we want to look at this belly here. Now, when the mother lies facing upwards, and then they try to lift their heads and then look at the toes, it's a contraction exercise that we want our muscles of the belly to be fine. So it's you lift up your head and then look at the toes while you are lying down. You look at the toes. You can do a repetition of at least 15 repetitions. Uh, then the other you can do is to activate still the abdominal muscles. You can still lift slightly, at least the angle of 15 degrees. You lift up the legs, both of them at a go. You lift and then you put down. Still, also, I recommend at least 15 repetitions. Why do we do this? We are activating the muscles of the abdomen or the abdominal muscles. We want to activate them as soon as we can, because during pregnancy they've been overstretched. So when we overstretch them, we want them to get the activation back. When they're activated, we now get now all these exercises that I'm saying are now in the postpartum period. The postpartum period is at least the first 6 weeks or 1.5 months, because what you do during the postpartum period gives you more energy after that period, because as I said, mothers that do these activations as soon as possible, then by the time you finish up the first 1.5 months, you have gained some energy, the muscles are activated. Now you can proceed, or you can progress the exercises that you do. Then the other thing that we do is the bridging exercise. How is the bridging exercise? You bend, of course, we are looking at the mother in a lying position facing upwards. You bend the knees. When you bend the knees, then you lift up the bottoms or the pelvic area. You lift it up. You're activating uh, the muscles of the quadriceps. Quadriceps are the muscles of the thighs in front. Actually, in front, the front of the thighs. Those are the quadriceps. We want to activate them because during the pregnancy the pregnancy period, we have been carrying a weight, your weight as a mother, the babies as well. At times, people have twins. So the weight that they have been carrying is so much. So you want to activate all these muscles to gain back their strength and energy, to gain back their muscular power. So as you do this activation, we help you get better. Now, the other thing we do is the Kegel exercises. All the muscles that we look at, because as you are giving birth via the spontaneous vaginal delivery, we are overstretching the muscles where the baby that the muscles of the birth canal where the baby is passing as they come to the world. So we want to look at these muscles gain back their integrity. So we do what we call Kegel exercises. The easiest one that we always give mothers: bend your knees and then you try as if you are stopping urine, or you also tighten the muscles of the buttocks. You tighten and then you let go. You tighten, then you let go. That activates those muscles. The other thing that you always do, of course, in the lying position, facing upwards, bend the knees. You can put a pillow between your knees, and then a caretaker tries to pull the pillow out as you're trying to squeeze it. That exercise is very, very, very good for you, and looking at the muscles where the baby passed. Those are exercises that we do for the spontaneous vaginal delivery. Now, for the cesarean section, on the other hand, of course, the breathing exercises, those ones cut across. Now, what is that unique thing that we do for cesarean section? You see my hands, then you interlock them. Now, this you put or you hold the cesarean site. This, you interlock them and then you hold on the cesarean site. So, whichever exercise that you are going to do after a cesarean section, we want to first of all strengthen or guard the incision site. Very, very important. So when you hold on to the cesarean section site, you can do these exercises slowly and gradually. You don't need to rush, you just need to take your time. Now, what do we do in this case? After you've uh, held on your incision site, you lift
Doctor,
up. Yes, please.
Mr. Buembo, before you continue, allow me, let us demonstrate that. You said we hold the hands, then we press it on the side of incision. So you do the exercise when those hands are there. Why do we do that? Oh, I think you muted yourself.
Sorry. So as the surgery is going on, they cut through muscles to reach the uterus where the baby is.
Yes.
So we want to give, of course, they did the sutures, but we want to strengthen as well to get kind of an added support to the incision site. Of course, as you're doing the exercises, these muscles that they cut through are going to be activated and they are going to be doing exercise. So we want as well to give a protective kind of guard as well as you're doing the exercise.
Okay.
So that's the reason why we do that interlocking of the hands and then you hold on the incision site.
Okay, you can proceed.
Yeah. So what we do next after we've done that, you still lift up the head and then look at the toes. Just activate. Just look at the toes. You can do at least 10 repetitions, uh, 10 repetitions for that exercise. Then the other exercise we do the ankle pumps. What do we mean with the ankle pumps? Now you look at the feet. I assume this is my foot and this is the leg. So you want to do that kind of movement of the toe of the foot. I'm just imagining this is my foot and this is the leg. So I'm lying. So I want to do the ankle pumps. Ankle pumps. You get? Very, very important. Then the other thing we do is the isometric kind of exercise. What do I mean by isometric? If I put my left leg over the right leg, and then I just tighten my muscles of the thighs and then the buttocks. I just tighten and then let go. You tighten and then let go. You tighten and then let go. We always do 5 repetitions when the right is on the when the left is on the right, and then you change, and then you do the same thing while the right is now on the left. So that's another exercise that we do. Then the other important thing that we always want our mothers to do, whether you are laughing, there are people who laugh and then they are, loud. Then you have then when you are coughing, because at times we have mothers who get cough, we always encourage mothers to still interlock and hold on to the tummy as they are doing those activities, because when you're coughing, the muscles of the abdomen are also part of the activity.
Okay, I think we've kind lost Dr. Solomon, but we shall pick him whenever he's back. Sharon, we've heard what Doc. Okay. Okay, Sharon, can you get me? Okay. Okay. So he will be back to complete or to take us through the okay, to finish up the exercises. You talked about health as being an important aspect. In fact, in your approach, you didn't talk much about exercise, and I believe that in this journey of weight loss, there are people who are going to take the exercise route, and there are people who are going to take the diet route, because by physiology we know that everything we eat, if it's not used up by the body, is kept by the body to do something else. I normally tell people that weight loss is very simple. It's just like building material. There are bricks, there is sand, there is water. For you, when you say wall, you clearly don't understand what is in. But everything that you eat, if you put, and I normally tell people that protein are just like the bricks we put on a house, and the sand is the carbohydrate. So you can never put more sand than the bricks. You can never eat more carbohydrate than the proteins, because the wall is going to fall down or it's not going to be strong enough. So can you tell us a health diet for new moms? What do you think after in this journey of giving birth? Because during pregnancy, we are concerned about what we eat. We want to supply the body of the mother and the body of the the fetus or the baby in with enough food and enough nutrients, both in the quantity and the quality. Now, after I've given birth, can you summarize for us that what a health diet for the new mom is going to be, putting in mind weight loss, weight gain, and also nutritional aspect to both the mother and the child?
Okay, so me, from my personal experience, is usually when you start thinking of, oh my God, what am I going to eat? Or is this going to make me gain weight? Is this going to make me lose weight? During a period which we call postpartum, and naturally after birth, you are worried, and most of the time you have stress of, let's say if you're a new mom, you are having stress of caring for this little being that you have brought into this world. You have stress of your body aching because you have just given birth. You have stress of not having enough sleep, especially in the night, because generally your sleeping routine changes. And then you add in the aspect of, what I'm eating, is it healthy? So from my personal experience, I usually eat foods. I mix. You have enough vegetables. You have proteins. They are good. You have even the bits of the fats like milk, you are having, literally, I usually generalize and ensure that I eat everything. You have enough fruits. So what I would do is ensure every morning you have a normal breakfast, then you have fruits, then during the day you have fruits, and then during the day you are taking in something like a cup of porridge or milk, depending on your breast milk supply. There are those people naturally I have interacted with, they just eat normal foods and they don't need to add anything, and they have breast milk. But then there are those people who actually eat and they are drinking and they are doing all sorts of what they have been told, and they don't have breast milk. Like the breast milk production fails. And then let's say if you chose like exclusive breastfeeding, you find yourself, you're on pressure. You are on pressure. Oh, my baby is not having enough. The child is crying. They are not feeding enough. So you are having a demand on the child. So if you are in a situation where you find that your child is not having enough, much as you are taking in everything that you have been told, you have studied, someone will say, oh, fenugreek seeds, all these herbal teas, this literally, I'm one person that go in for all. And then you realize that they are not really working for you. So I wouldn't restrict someone that take this and leave out this. No. What I would encourage is have balanced diet. Ensure you're having fruits. Ensure you're taking enough fluids. You're having some juice or you're having some teas or whatever that you feel like at that time, because it's really a stressful period that most people don't realize. It's different from, I would also want to touch on the part of, it's different from back then with our mothers and our grandmothers, in a way, especially in the African setup. In the African setup, back then you will have, when you give birth, you have like two people around you, or you find that you have moved to your parents' home. So they take over the responsibilities, but things, or they send you someone that will care for you. But things have changed. Things have changed. You realize that everyone is literally busy, and you are a new mom, and you are doing everything by yourself. So I would encourage that do what works for you during and after baby. Have plenty of foods that you feel like they're okay with you, but as long as it's balanced diet, you are not picking on one thing. Because when you pick on one thing, you'll either be underweight or you'll be overweight. And even if you gain the weight, I would still say, even if you gain the weight during the first 6 months, it's okay. It's okay, because it depends on how your body is reacting to that, and how you are producing enough breast milk. And by the way, it doesn't mean that eating a lot of food equals to having a lot of breast milk. No, you can eat a lot of food, but if you are not having rest, if your mind is, usually the breast milk is released by a hormone, and this hormone is mostly produced in the night, when you are at rest. So when you don't rest much as you are eating, then you find yourself gaining weight, your child is not feeding well, and you are naturally stressed about it. So I usually encourage mothers, rest at any moment that you get. Let's say you have 3 months at home, there are those who don't get it, or 6 months at home, there are those who don't get it. It's not that you have to be at home, but if you have any chance that you get, the baby sleeps, you also sleep. When you sleep, that is the time actually when you have breast milk formation coming in. So you can have all that, consume everything, but if you don't rest enough, you actually will end up with still not breast milk. So I don't usually restrict moms in the first 6 months. Eat what makes you feel comfortable, but ensure that it's balanced. And then another thing that you have to realize is our bodies are different. Please don't look at someone. I actually have co-workers. They are so slender. after baby, they take just 1 cup of tea and they're like, oh, actually my breast milk is full. Let me go. I can't get home and breast. I'm like, how do you do it? It's just natural. Our bodies are different, like totally different. If you look at someone who did everything by the book and still failed to achieve it, it's me. I can say I was health freak in terms of what am I consuming, in terms of exercises, in terms of walking during pregnancy. My husband and I would walk literally every single day, but I continued to gain weight. Every single day we would walk almost 2 kilometers and back.
Oh,
So walk, it's just the body, the physiology of us is totally different and it is individualized. Keep that in mind. Yeah.
okay. So I've picked a lot of things from Dr. Sharon. Number one, to the mothers out there, every mother is different. You will never be like your neighbor. Number two, in terms of milk production for the baby, that is actually a big discussion point that we shall have later, because one of the questions that someone actually has put in our comment question that you react to towards the end is what do you advise mothers without breast milk? What naturally can they do? What can they do? That I've also understood that what Sharon eats may not be what Annette needs to eat to have breast milk because our bodies are different. So it's about that you, young lady listening, or you, mother listening in, to find what actually stimulates your milk, the milk glands in your breasts. But most importantly, you say that milk production happens when the mother is less stressed or when the mother is at rest. Now, that is very important to all the mothers out there. Most of you have had issues having to do with breast milk because maybe some of you are not resting enough. But now this also calls in the fathers. It means we have to help to assist with this lady to have some rest. Sometimes you need to handle the child. Sometimes they are in the first month, the baby is crying a lot, literally, because they are adjusting to the harsh environment. Sometimes it is cold, sometimes it is warm. They have been in a calm, clean environment without tear gas and noise. Now we are in a political campaign. Everyone is making any kind of noise. Sometimes we've got to husbands to come in and help. Before I got the next tips on losing fat belly after baby from Dr. Sharon. Dr. Mr. Solomon, by the time you went off, you were concluding on the exercise. Can you, in a minute, conclude that? Then we shall go to the next item, that is practical tips for losing fat berries at home. Yes, Solomon.
Actually, I had concluded with the
Okay.
exercises. So maybe if you can just go to the tips of losing the belly
Okay.
weight.
Let me start with that with you, actually, Dr. Mr. Solomon. What are the tips of losing fat belly at home? Now we are talking about we are talking about a mother. For example, you've healed. Our first discussion has been on that mother, maybe below 6 months. Sharon has put it well that to the lady listening out there, you don't have to limit yourself. In the first 6 months, look at your child as a priority. Eat whatever husband has brought. Eat vienda, eat mukene, eat everything. You eat as long as you love eating it. It does not affect you. Eat. Then after 6 months,
Moderation.
when the baby can support, maybe can start additional feeds, that's when also maybe the mother should now start worrying about weight loss. Because maybe after 6 months you're going back to work, maybe you want to start going out to party again, because now the child can actually feed on other feeds. And again, before actually I go in with okay. Again, as before I continue with I also want to highlight something important, Sharon, that you've put. Sharon is a mother. For we shall accept that. One of the babies is joining in the live presentation. You said something important. Young ladies and breastfeeding. I want to emphasize this. One of the reasons we are having children that we don't understand in society today is young ladies start stopping or refusing to breastfeed. Number one, because you're protecting your breast, you don't want to fall down. We don't know for who. Because us, the men, we are not interested in that milk. Are we, Solomon, are we interested really?
No.
So you refuse to breastfeed the people you're supposed to breastfeed because of I call them selfish interests. Then you're feeding our babies with milk whose production even we don't know. Because I was reading a documentary somewhere, someone saying some of this milk is actually camel milk. It's made from the camel, and yes, it is on YouTube. So I won't say which product, but why do you expose your child to milk you don't know its production process? And yet, God gave you two large, big, well-shaped breasts. For us, He knew would not handle that. He gave us the small ones. For you, God gave you two beautiful ones. If you want to know, to appreciate the creation, I want you to read Song of Solomon somewhere where it is said it is shaped like over what, like what. And then you selfishly refuse to breastfeed that child. So before we go into tips again, I want to tell you, if you're here and you're interested in buying cars, if you want to purchase cars from legit people, one of our partners of this program is called eMotors. eMotors are located in Uganda, and then they are in Naguru, Banda. You need to trust them with your car issues. You don't have to look for money to buy a car. Then you also spend sleepless night to confirm you're buying a legit car. No. Go to eMotors for the best cars. You want to reach out to them, you can call them on 0775 72 1536 or 0752 25 10 92. They are in Uganda for all your car motors. You're going to see their banners running on all our programs for the rest of this month, because they are partnering with making sure that Ugandans every Sunday morning get the best of best healthcare advice by partnering with us. So eMotors, for all abakozeemu abetaaga ku ssente. You need cars for campaigns, you need open roof. Do not go to vibe, you want to become an MP and you're going with the Toyota Alex. No. Leave Toyota Alexes for healthcare workers that are less paid. Okay, let's proceed. Sikubye nnyo. So as we go into part 2 of this program, Solomon, let me start with you. Give us basic tips as at home, because normally this program is made for muntu wa wansi, not for women that can go to gym. If I come from Katente, Nachisunga Mukono district. I love that area. Every program I make sure I talk about it, because of them I'm here having this. What can you tell a certain Namakula Namukasa in the village there that gave birth, but they practically want to lose that fat belly at home?
Well, thank you so much. Number one, what we need most importantly is the commitment of the mother.
Okay.
And then the discipline of the mother. Because this is not a one-day journey. It's a journey that is continuous. So when you're disciplined that if you are doing it morning and evening, please take time and do that. Now, what do we do? Number one, we have what we call the plank. What is the plank? You lie facing downwards, then support your body with this area of the forearm, and then on your toes. So you lift your body up, and then hold for around some few seconds, around 10 seconds. That's a very good exercise for you to work on that belly fat. You can still do that for around 10 repetitions with a holding time of around 10 seconds as well. But this one goes on gradually increasing as the muscle integrity also gets up as well. Then the other one is the side leg raise. You go on your side, this still holds your body up. You kind of visually have your body in that side, and then it's off the ground. Then you raise up the hand that is up. Then you start lifting the leg up and then down, up and then down, up and then down. You do that for around 10 repetitions. Then you change the side. If you are starting from the left, you lift up the right legs up. Then you go to the right side. Then lift up the leg, the that one up. Then what you have the next is, and I always recommend this one because it is even safe. You lie on your back, you raise your knees, and then step the feet on the wall. Imagine you are seated, and then you reverse your seat into a lying position. In other words, you are maintaining the 90 degrees. So you're lying, then the hip joint maintains a 90 degree, and then the knee joint also gets a 90 degree, and then the 90 degree also is on the ankle joint. I don't know if people have understood that very well, but in that
We are trying to understand, but next time I think I'll actually host here, I'll ask you to demonstrate, like to have a
okay,
demonstration such that our people there can literally see what we are talking about. But you can proceed.
I look forward to that. Um, then you lift your hands and then touch the toes, as if you're doing a sit up. But this one, you must take note that it's done after the postpartum period, because now these exercises are now stronger than the ones that we did in the first place. So by the time you are now stable, this is when we need you to do these exercises because they're a little stronger. So you lift your hands and then touch the toes. Lift your hands, touch the toes. Then in the same position, your hands touch the wall. Now the below or the lower part. I don't know if members are getting it. Because if imagine a chair that the the backrest is now put on the floor, and then this chair is put now to the wall. The Let me call them the legs of the chair are now put on the wall. You get? This is the position that we are assuming. Now, the front legs of the chair are put on the wall. These are your legs. When you look at this area where we sit, those are the thighs, where your thighs are. Then this one where we like lean against, that's your back. So I think this is a little more practical for us. So we're now in the first place, we are touching our hands on the upper part of the chair. Then after that, we're now holding on the lower legs of the chair. So you do it sideways. Take your right to the right side, left the left side. That's another exercise that we really want us to do. But mainly, that exercise has given us very good results for the abdominal muscles, and the belly fat is always lost by that.
Okay. Thank you so much. Dr. Sharon, back to you. Can you take us through the role of managing sleep, stress uh, to a mother that has just given after birth? You talked about sleep being important in milk production. Can you talk about sleeping, managing stress, and hormones at large in this journey of trying to lose weight after birth? And then also to because we are looking at weight loss after pregnancy, but also safe and effective tips to moms. Take us through the stress management, uh, managing sleep and hormone-related issues in this period.
Okay, I would still go back to my experience because I have seen it at first. You know, when we have, especially our first child, our moms naturally will go into a protective manner. You feel like you are the one who knows everything about the child. You feel like you have to be there at every stage. sometimes even when the help is there, you feel like you have to be the one to do everything. Sometimes it ends up being feeling like a guilt thing. You take it up and feel like, oh my God, if I'm not the one uh, bathing the baby, maybe I'm not a good mom. Or maybe if I'm not the one putting the baby to sleep, or it's going to take away my emotional attachment from the baby. But I would say no. At first I wanted to do everything, but then luckily I had a very supportive husband, so we really interacted and agreed. He would I would breastfeed the baby and hand over the baby to him, and he would put the baby to sleep. And even when at first my sister took me was I stayed with my sister for almost a month, and she would come and take over the baby. Even when I felt like I had to do literally everything, she told me, no, you can't do everything. You can't be up in the night. You can't be up during the day. Can you sleep? So she would actually take the baby from me and make the baby sleep, and then so that I can have rest. She would even take the baby away. Have you breastfed the baby? Yes. Are you able to pump breast milk? Yes. Pump the breast milk, give us the bottles so that you can have rest. Rest is very important. It helps your mind, it helps you mentally, it helps you physically and emotionally so that you are ready for the baby. So I encourage, when you have the chance to have someone care for you or support you. In our second baby, we actually stayed. It was with my husband, literally, and all the time until when my sister also came in to stay with us. But the thing is, accept all the help that is needed. Involve. That's when I actually bring in the part of a father. If the father is present, involve the father. Let us, especially in our African setup, let us drop the narrative of a father can't do anything with a baby. No, let the father help you in bathing that little baby. Let the father be involved in caring for the baby, in cleaning the baby, in dressing them up, in literally just you ensure that you're all, because remember that you are caring for this little baby, but you are also healing. Because what happens is when you are pregnant, organs are actually pushed up, they are pushed away and given so that you so that they create enough room for this growing baby. So when you give birth, your body has to actually go back to the way it was supposed to be. It was before, the baby. So allow all the help that is needed. Involve the father if the father is present. Involve them all the time. Let the father help with the bathing. Let the father help with cleaning. Let the father get up and carry the baby when they are crying. Because much as yes, some of us we think that yes, for them they have to wake up and go to work, but when they are there, let them take that responsibility. It's very important. If you can have, I know that in Africa it's very easy to have someone care for them. Actually, eventually, I even had to have like a bedside nurse. If you are able to afford a bedside nurse, have a bedside nurse. You need all the help. Let them care for the baby, and you're always ensure that you are having enough rest. You're breastfeeding your baby, and you're physically present for them. On my second baby, I was actually on the road as well. First month, within just 1 month, I had to go back to I was studying that time. I was doing my medicine. I had to go back to studying, but still, even when I left my baby for 1 month, I exclusively breastfed. I had to pump breast milk throughout so that the baby, and whenever I would return, I ensure that I have plenty of rest. Take naps within the times that you have, so that it's very important. It's going to help you release the relaxing hormones. It's going to help you release the hormones which are responsible for breast milk formation, and physically you find that yourself when when naturally you're getting better. So it's very important on how you react and leave out the protective part of it. Yes, it's natural, it's something that is God given to be protective, but sometimes you have to realize and let go and allow other people in to help you in having this child. Yeah.
Thank you so much, Sharon, for that. And I want to actually to appreciate Engineer Kamba. I knew he was. I knew. If you're there, I knew just a few meters from there because he's one guy that I've always known to be around the masses. And Engineer Kamba, my great friend, I thank you so much for supporting Sharon all through and for making sure you were testimony in this journey of weight loss. So to great husbands there, let us support our women. To the policymakers out there, men to need some paternal, you call it paternal leave to support these women especially. I know some countries and companies are giving 1 or 2. Yes, give them 7 days. Let us advocate for 7 days of paternity leave because these mothers need support. These mothers are going through. We are in a generation where we no longer have luxury of so many people coming to our homes to be with us, which was the story ago, so many years ago, when a lady gave birth, the mother, the aunties, everyone would come. But now we are having families struggle to raise children alone. Let us advocate that we have more paternal days for fathers to support their women. Some of these women have undergone through C-section. So they are discharged from hospital. The husband has to go and work. The child is crying. This young lady cannot support herself. Please, to the policymakers, more days for paternity leave to help us support the mothers and their babies. And thank you so much, Sharon, for articulating it well. Do not stress those mothers after giving birth because the moment you do, you're literally stopping everything. It's going to have an effect on breast milk production. It's going to have an effect on their healing. It's going to have an effect on their mental state. And when all that is disturbed, the effect is now turned onto the baby. So while you're having that young mother, the father, to the new father that is there, make sure you don't stress them. Make sure they have the best of the best of their mental state in that period. Again, let us go to our second last topic of the day, breastfeeding. Sharon, what do you say about number one, in a nutshell, tell us the importance of breastfeeding to the mother and the child. Number two, you're going to tell us what can a woman do if they don't have, practically, if they don't have breast milk. Thank you.
Thank you. Well, the reason why I chose to breastfeed my 2 children exclusively, especially for the first 6 months, I was looking at their health. Most breastfeeding, it has both advantage on us as the moms and also as the child and also this growing infant. One, it helps us in bonding. When you breastfeed a child, you are actually bonding. You bond with the child, you grow, and also it also helps with the brain growth of this baby as they stimulate. As they are stimulating to breastfeed, it supports their growth. Breastfeeding as the mom, when you are breastfeeding naturally, it also helps the muscles, the lower muscles that were so much relaxed, they contract back, and so as also the uterus that was hosting this baby. So when you breastfeed, it actually helps you as the mother to also have it back in place. It contracts as you breastfeed. And by the way, even moms who have breastfed before, they would tell you that when you start breastfeeding, you feel pain, a little bit of pain in the lower abdomen. That is the muscles that are contracting back, and so is this uterus is contracting back and going back to the pre-pregnancy shape. So breastfeeding helps us physically, emotionally, as in bonding, also with the baby. I would also talk much more on the baby health. Once you breastfeed, because breast milk is naturally formed and made with a ton of nutrients literally everything that is needed for the child to grow is formed into that breast milk and compacted together. So when you give this baby natural breast milk, you are giving them all the nutrients that are needed for this child to grow. That's why in the 6 months it was confirmed, and it is made studied and shown that within the first 6 months a child can grow healthy, they can gain weight, they can be okay with just breast milk, because it is the best nutrient, it's the best food that you can give your child. It also protects them from it protects them from illnesses, from diarrheas, and all these other diseases that come up when a baby is young. Actually, what happens is when you start feeding this baby before 6 months with these other foods, they are usually, we call them hard foods. Even when it's anything like water or milk or anything that is not breast milk, the natural gut of a baby, it's usually very soft, and it was made naturally to receive only breast milk. So when you give this child other things, they affect, and this little baby ends up with tiny wounds around the gut, and these tiny wounds are going to affect them, and that's when you find that most children, it has been also confirmed and studied, all these children who are not breastfed within these first 6 months, they are prone to diseases. They are prone to especially diseases of we call them gastrointestinal diseases. And that's why they end up with diarrheas and all these, related diseases, because their gut is not made to support all these other feeds that we give the children. We call them hard. They are hard for them. They cause tiny wounds, and those tiny wounds are prone to bacteria that cause infections to the children. But when you give this child only breast milk as recommended, you are protecting their natural gut, you are protecting them, and that's where you find that it has also been proven, not only with my children, it has proven a child who's exclusive breastfed, they barely fall sick from these illnesses that we are talking about. They barely fall sick, literally. I don't remember taking my child in a hospital because they are having these tiny infections that I hear people talk about, the diarrheas and all these related, they barely fall sick from that, because natural breast milk has been compacted to have all these nutrients. And that's why we also encourage mothers that when you are breastfeeding, have a balanced diet, because that balanced diet is what the baby is going to be, given, even when it's not so much. But as long as you are eating, having a fruit or any small feeds, you find that the child is going to take in all these nutrients, and they are protecting them. So especially in the African setup where you don't have everything, even in not only in the African setup, breast milk has proven to be the best. When you talk about a busy mom, and someone will ask a question of, okay, now me, I'm a very busy mom, I can't be home for 6 months to breastfeed the baby. No, even me, I was never home for my two children. I didn't stay home for even 2 months. Within the first month, I was already back to the hospital because I had my children while studying. But I devised means of getting a very affordable breast pump, and then you have this fridge and freezers, so you pump breast milk ahead of time. You return from work, you pump like 2 packets, keep them. So before every morning before I left for work, I ensured that this child had 4 packets uh, pumped of breast milk. Even when I was one of those struggling. When I tell you that struggling, I had zero breast milk if I didn't take anything. So I don't believe in such a thing as you can't have breast milk. Yes, you can actually not fail to have natural breast milk at all. I'm one of those moms that was not lucky to have, and that is for both my children. But I ensured that I took what helped me. I tried all sorts of things that I've been told. I rest and take. I found that hot milk was helping me. Others, it might not help them. But hot milk, I took hot milk. I took different things that I was advised. But I ensured that I put extra time for my children to have breast milk. I still repeat, I'm one of those people that I will not have anything in the breast if I don't consume. So I had to take extra, and that came with so much weight gain, weight gain. But it's okay as long as you have a goal and ensuring that your child is going to exclusively breastfeed, because their benefits are much more than the weight gain that you can have. The benefits. And after, guess what, when our children are breastfed, we go on and we do our other things. It is rare to find us in hospitals because the child is having this sickness, it is completely rare. Sometimes people would ask me, I've not had I remember actually recently, my daughter of how many years, she's 6 now. It's just of recent that she got a cannula, and it was because of malaria. Recent, just for the first time in all her years of growth. And I contribute that, and they would look at them and like, your children are healthy, what are you feeding them? I tell them that exclusively breastfeed your children, and even after exclusive breastfeeding for 6 months, go on and breastfeed your children for 1.5 years. Eventually you will not find them with any issues. Yes, I hope I have. You're muted.
Thank you so much, Dr. Sharon. Now, actually, your story of breastfeeding amazes me. We are talking about a medical student in her final years of medical school, exclusively breastfeeding. Then there is you, Namakula, who just operates a mobile money that feels you're too busy to breastfeed your child. Now, I will speak to this as a father as well, that the mother to my daughter did the same. And the same result, I want to tell you, our daughter has not fallen sick until she reached the age where she started getting issues with her teeth.
Yeah.
The only thing she would have is flu from school, and which was naturally treated by smoothies and things like that. And now I also know people who have children, in just before their first birthday, they have visited hospitals like every month, like twice every month.
Yeah.
And just like you said, GIT issues. It is diarrhea. I want to encourage and re-echo what she has said. Exclusive breastfeeding is essential for your children below 6 months. I'm telling you, you may love that job so much, but you will spend much more money than actually you're making if you give up on breastfeeding. And I love her approach of saying it doesn't mean she's not going to go back to school, but there is what we call breast pumping. Before we became so selfish like we are today, even children who lost parents at birth, they would get old women, old grannies that actually used to give them breast milk. I was reading about this. And actually it told me that every woman will have milk when they are stimulated well. We are talking about a grandparent, they lose their daughter giving birth, and the grandparents now breastfeeds their children. This is what used to be done. And that's the so-called old generation that didn't go to school. Now, ask the .com generation that have read the values of breastfeeding, that know the impact. We are the one that are stupidly, selfishly refusing to breastfeed children. Those are the children that are causing havoc in society today. You see an adult behaving in a way, they are driving on pavements, they are driving in one way because they're having expensive cars, and you're like, oh my God, how did this one grow up? Those are the children that were breastfed on formula from day one. And I'm telling you, those are the children you keep taking to hospitals every now and then.
Yeah.
You don't want to breastfeed them. When she wants milk, not everyone is going to be as clean or as careful as you. You're leaving the maid with your child. You're leaving a lot of duties to do at home. She's cleaning the house. The child is crying, and you think she's going to take clean precautionary measures. No, it can't be. That's why every week you're asking for days off to take the child to hospital.
Yeah.
At the end of the year, you're spending more than half of your salary on the sick child. That's why we started this program. We need to have more enlightenment to the mothers out there that have breastfed their children exclusively for 6 months. Kudos to you. You just don't know what you're doing for those children. I have seen parents that are taking children to school. The children are finding it hard to even understand your obvious things. And sometimes it's simply because you denied them the best milk when their brain was growing. We are talking about the first 4 months in pregnancy and the first 6 months after birth.
Yeah.
The body's major organs are growing. And then you're feeding them on formula whose production you don't know, whose origin you don't know. You're denying them breast milk whose origin you know, whose diet you're sure of, and whose benefit you're sure of. So thank you so much, Sharon. Lastly, Dr. Solomon, take me through, or take our listeners through in the next 3 minutes as we wind up today's session. C-section recovery again. I'm so worried about that because a big majority of mothers today are undergoing a C-section for so many reasons. I will have a discussion with a gynecologist soon because that's one question. Some people are saying, are we medical workers are forcing mothers to go through? And I'm telling them, no. Sometimes it is not, it's actually a request of the mothers. Sometimes actually it is medical reason, and they're saying, oh, it used not to happen long time ago. Why is it rampant today? And we are saying, yeah, because the way of we live life today is also totally different from what we used to be so many years back. So I'm going to have a gynecologist expand on that topic. But Solomon, before we go into the question and answer session, last discussion, take us through the C-section recovery journey.
Yes.
Before Sharon concludes with a meal plan during weight loss. Yes.
So thank you so much. And actually, I did a research concerning postnatal physiotherapy in
Yes.
Chiroga Hospital.
Mm.
And I realized that those mothers that actually did exercises in the first after 24 hours, they got one pain relief, because majority of our mothers fear that when we do exercises, pain is going to increase. It is actually the other way around, that pain is reducing. And then what do we need to do as we ensure recovery after cesarean section? Now, in terms of exercises, what is it that we follow? One, I talked about the breathing exercises. Number two, maintaining our grip. Very, very important. Now, what else do we do in this case? Proper positioning of ourselves. One, during breastfeeding. This one cuts across. We always recommend a mother to get a pillow, then they put on the baby as they breastfeed, such that they do not have to, get that extra bend to maybe take the breast towards the baby's mouth. Get a pillow, and then that position is very, very, very appropriate for you. As you're doing your chores, we always do not recommend much bending. Yes, bending is inevitable, but at least if there are ways you can reduce the bending, is very, very important. What do we do in this case? For example, if one is sweeping, can we get a broom that has at least an extra handle where you will do your sweeping while you're standing? Very important. As you're doing, maybe you're washing the utensils, simple clothes. Can we have it done maybe in a sitting position or in a standing position, where you do not have, to do that over bending? It's really, really not necessary. Then the other thing that is actually coming up when the gynecologist will come, we have seen sepsis coming up. We want our mothers to be as clean as possible. Yes, you are looking after the baby, but also you need to be as clean as possible, so that you don't get infections around the incision site. If you're going to do anything, please wash your hands. That's the basic thing that you have to do. to our mothers. Wash your hands, handle babies' utensils, cleaning them, even if you're doing exercises, because we said you have to hold on your incision site. Make sure your hands are very clean. Then the other thing that we can do is the hollowing your tummy. The Luganda version is called okuwewa. You know, I don't know how the others talk about that, but hollowing, you still breathe, but then your tummy is kind of a hollow in there. That one is a very good exercise for you. Then I talked about the ankle pumps. As you go on increasing, you have what we call the Russian twists. Though we do them slowly, we don't take so much angles. You just take very small angles. What is this? You bend your knees, then take them to the left and then to the right. To the left, to the right. Always recommend 10 repetitions. You count them on one side, either the right or the left. You decide which side you want to look at it. But mainly, that's a brief of what we want our mothers who have undergone cesarean section to do. Thank you so much.
Okay. Lastly, Sharon, before you go into to the comment section again, if you're out there and you're interested in having yourself a new ride or a second used car, I want to tell you to consult eMotors. eMotors is available. Their contacts on all social media platforms. They are located in Naguru, Abanda, Kampala. Just go to Twitter, put eMotors, Facebook, TikTok, and everything, and then you'll have their full contacts. I'm telling you, I wouldn't be on this program to tell you a company that I'm not so sure of. So if you're there and interested, Dr. Solomon, I think you need a new car to Chiboga in this campaign. Kuba ebinnya by'amaanyi weetaaga emmotoka ey'amaanyi. Okay, so Sharon, we've talked about breastfeeding, we've talked about exercise. Lastly, can you tell us in terms of meals? Abantu baffe baagala nnyo okuwulira. In terms of meal, what should be the meal plan as you're planning your recovery journey? You've handled you're sure the child is well, you're sure the child has been exclusively breastfed. Now this mother wants to know, how can I regulate my intake of food to make sure I achieve my weight gain?
Yeah, I'm always interested in this because so many mothers have always asked me, how do I do it? How did you do it? And somehow I lacked a better platform on how I can share with everyone. Perhaps we shall have uh, maybe another session where I can take them through fully on how you can get your body back.
Of
Like
course.
what
Of
I have
course.
done. Yeah,
Yes.
it's very important. So one thing that I could start with, since we don't have much time, is look at what when you are eating something, when you are consuming something, you realize that I'm taking this and this has made me gain weight so much. So as you phase out breastfeeding, try to start phasing out what you're taking. I would give an example of course, you look at the foods that we eat. The carbohydrates, it's like one of the biggest thing that we don't realize. Because when most people think of healthy eating foods, they think, oh, I can have a potato, I can have matoke, I can have cassava, I can have rice, and I didn't fry them, so they are boiled and they are okay and they are healthy. They are not. When carbohydrates play a very big role in your gain weight, and almost every food that we have in Uganda, almost every food that we eat, of course, it's a carbohydrate, and carbohydrates make us gain so much weight. It makes us gain so much weight, and that weight of carbs usually stays. It's put up because carbohydrates naturally their role is to build the body. So guess what? As long as you are consuming matoke, potatoes, what on every plate of food that you eat, much as it is steamed, because for us, our mentality is once the food is steamed, it's healthy and it will not make me gain weight. And someone would even ask, they will say that, but I'm eating healthy. No,
Yeah.
I'm eating steamed matoke, nentekako, and I add a potato, and then I add my beans, or add meat. No, how you control the weight. You realize that per serving, you just need 30% of a carbohydrate on your plate, and you can have 70% of protein and vegetables. What do I mean by 70% of protein and vegetables? I mean, let's say you are having this matoke, or matoke being the most commonly served food here in Uganda. I would use it as an example. Matoke is a natural food. It's a natural food, but it also has carbohydrates. Most people are lied to and are told that matoke it's just water. No, it's not just water. It actually has carbohydrates, and it can make you gain weight as well. So when you are serving it, have 30% of it on your plate. 30%, that means a small control portion. I think maybe in our next session, we can share photos of how I usually serve my meals, so that someone can have the visual part of what 30% means on a plate. So have 30% of that on a plate. What I actually advise most of the time is every food that you cook, ensure that you have vegetables, be it cabbage or be it avocado. Those are the most easily, be it greens, dodos, all sorts of greens. They are very easy to access, and they are very cheap. When you are going to serve that food on your plate, start with the vegetables on your plate. Don't start with the matoke and what. Ensure that you have at least enough. That means half of your plate that you are going to serve should have greens. And after that greens that you have served, half of it, add a protein that you are going to have. A protein can be any, whether it's beans, whether it's matoke, whether it's beans, whether it's meat, whether it's actually proteins. They don't usually make us gain so much weight. It's the carbohydrates that make us gain so much weight. So have them served. That means that 70% of your plate is taken up, served first. Once they are served, then you can add that 30% of a matoke. If you decide to eat a matoke, let it be matoke. If you decide that today I'm going to have a potato, let it be potato. If you decide that today, I usually advise moms that I have helped. I have actually helped several moms lose weight through just meal plans, not even going to the gym or anything, and they chop so much weight. Let's say you are going to have these meals. I usually encourage natural foods. Rice is processed, posho is processed. So when you are having this, much as we have to have the carbohydrates, look out for the ones which are natural, which are naturally planted and harvested and just cooked. If it's a potato, let it be a potato. If it's a cassava, let it be a cassava. If it's a matoke, let it be a cassava. But do portion control. Portion control 30% of that, and the rest is vegetables. And when you have those portion controls, trust me, put them in your mind and make that do that meal plan for a month, and you say that for 1 month I'm going to be having a 30% of a carbohydrate, and the rest is proteins. You can have 2 pieces of chicken, you can have lots of vegetables. You can eat as much vegetables, by the way. Even if you serve, they cook a whole saucepan of them and you have them. Because usually what happens is when you are adjusting your body from the way how we have been eating the multiple carbohydrates to now controlling the carbohydrates, your body will demand, will start feeling hungry. You start feeling like I have eaten and I'm not satisfied. So ensure that you have enough of vegetables, and 2 pieces of chicken is okay. Meat, even if me, I'm a meat eater and I've been able to lose weight even when I am eating my meats, but control the carbohydrates. So I don't usually stress my body and say that I am dieting, I have cut down everything, because that's what most people do. They cut everything off. They are not eating, they're not having enough fluids. And by the fluids are also very important. Ensure that you are having warm water. Take as much water as possible. Warm is better because it's easily taken up by the body than when it's very cold. So you can have lukewarm water if you are able to do that, or just any warm, but ensure that you take at least 1 liter to 1.5 liters of water per day throughout the day. If you can have fruits, perfect. You can have, and usually when someone has gained so much weight, they also have that craving of sugars and all that. Replace the craving of sugars with fruits. You can carry them in a container, because I know that most people, all of us, we are going to work, and snack on fruits. Snack on fruits. Snack on steamed vegetables. They are very tasty when you steam carrots and some French beans and anything that you can have your hands on. Snack on them and just control carbohydrates. Carbohydrates is like the biggest killer. Almost everyone who goes to the gym, they will tell you, but I have been to the gym. I have talked to this person. I have done everything, but I'm not losing weight. But guess what? You go back home, you serve yourself matoke and rice and potatoes on one plate. That is like the biggest killer. So the secret is in controlling carbohydrates. I believe we shall have more session on how I can practically show that. But I hope that you have captured something from there. Yeah, thank you.
Okay, thank you so much, our panelists, for the day. I've learned a lot. And like I always tell people, that one thing I come in here is I'm always sure I'm going to learn a thing or two. The reason we started this program is to inform mothers, or is to inform the public. We have a lot that we know as healthcare workers, but we're lacking platforms to put this information out. We believe that the more we empower people, is the more people are going to make informed decisions about everything. We have talked about a lot of things today. And I always say our role is to talk, your role is to act. To the mothers there, I re-echo again 6 months of exclusive breastfeeding. Now, we totally understand as healthcare workers that they are mothers, because of different healthcare conditions, cannot breastfeed their children on advice of doctors or medical experts. Do not use this program and say, oh, they said we must. No. They are mothers due to medical reasons that have been stopped. Please adhere to the instructions of your healthcare practitioners. To the government of Uganda and all the governments in the world, I want to thank you for including nutritionists now in the antenatal package of mothers. But again, I want to continue pleading and asking that we at least provide these nutritionists or healthcare workers in charge of diet on the routine packages, or in the routine. It should be made mandatory that at least in the 9 months of pregnancy, a pregnant mother at least sees one nutritionist. Because like Sharon has shared today, there is a lot of information that is supposed to be given to this mother, which we believe sometimes is not given by our friends in the antenatal, not because they don't want to, but maybe because they have less information. They are more concerned about these other routine things, malaria checkups and everything. But the whole of this program today, we've seen the relevance of proper diet. Number one, to the pregnant mother, to the growing child, but also to this mother after birth, in a supporting a body to breastfeed, but also supporting the growing child and making sure that the milk that is being produced by the mother actually has all the required nutrients. Because trust me, if we don't supply the mother with the required nutrients, then there is no way the breast milk is going to be having all the nutrients that are required. Again, we thank all the supporters in the healthcare system that are supporting the healthcare system, especially in Africa and in particular Uganda. Thank you so much to the social organizations, to the non-government organization, to World Health Organization, and all the other partners. Thank you so much for choosing to support mankind. You would have put this money in forests, in preserving wildlife, but you chose to invest in healthcare workers. To all the healthcare workers in Uganda, government and private hospitals, thank you so much. I always say, no one will ever come out to appreciate you. They are not going to give you medals when they are rewarding heroes. But in this program and at this time, I want to tell you, your heroes that are supporting the population. You're less staffed everywhere. You're less paid. You don't get appreciated that you like you should be. But I want to tell you, God is watching and he will reward you. From both the medical and non-medical staff in all the healthcare centers. Thank you so much. Lastly, we have, we call them one-on-one sessions, hot ones, for my panelists. Sharon, number one, someone is asking, does sexual intercourse help reduce weight? Yes or no?
Yes or no?
I know you're saying what a question on a Sunday morning. Okay.
It's a yes or no.
Yeah.
If you're having it because you want to lose weight, really, no. Because such a, yeah, much as it's an exercise on its own, but it should really short-lived, that it will not give you long-term benefits, you know. Because at the end of the day, if you are having it and you are still consuming all sorts of carbohydrates and fats and all that, no, it's not going to help you, you know, lose weight. But if you're having it and you are exercising, rather, I wouldn't say exercising, but it's very good to like stretch and walking. Sometimes I would take walks, and you are mostly actually weight gain is what we are consuming in. I remember one of our lecturers when I was in medical school was telling us that it's garbage in and garbage out.
Okay, Sharon.
So
You're
yes.
diverting us from the question, but thank you so much. Next, Solomon. Uh, does uh, does walking during and pregnancy uh, after pregnancy help to control weight?
Yes.
Okay. Sharon, lastly, what natural things do you know help to increase weight? Sorry, help to increase breast milk, local available. You unmute, please. Yes.
Yes, I wouldn't really, as someone who extremely, when I say extremely, I've been on the extreme side of not having breast milk. I wouldn't really point to one naturally thing, but the naturally available is rest. When you are having intermittent rests while breastfeeding your baby, it helps. It's the most, at least it's the most proven, because the hormone which is responsible for breast milk is mostly released when you are sleeping, when
Okay.
you are at rest. Prolactin, one of the hormone that is stimulated for breast milk, and oxytocin, a hormone which is natural, which is the one that sends in the, you know, the signals for prolactin to breast to release breast milk, is naturally released when you are sleeping. But the rest, it's mostly try and error. Have plenty of fluids if you can. I found that hot milk, which I wouldn't have expected, because I tried all these other sorts of things that I was given, including the herbal mixtures that are made by so many health professionals. I tried all sorts of things, fenugreeks. They are so many that everyone will tell you, did you try this? I tried everything. When I tell you that I tried everything, I had like a whole cabin at home full of all these different things, including the meats, the mukenes, the all those sorts of things that I've been told. You know, everyone has their what can help, what can work. But what I found out most effective is whatever you take, mostly warm drinks like hot milk or porridge, loose porridge, try to rest. Even if it's a 20 or 30 minutes nap, when you take that, rest. At least that proved to give in, to give something. Yeah, but I can't pour it out one.
Yeah, my experience is Mokene. I remember Mokene, and then also Solomon. What has been your experience? What do people in Ichivoga talk about that increases breast milk? You never know someone watching may.
Majority of them are talking about Ushera
Okay.
and the porridge, but I'm yet to experience that anyway.
Okay, lastly, someone said, Solomon, talk about what women call tying the abdomen after delivery, okusiba olubuto, in just a minute. Have you heard about tying the abdomen?
Yes, I've heard about it, and I've seen people practice it. However, majority of them at the end of the day stay with that large belly. So physiologically, we don't have that information about it. However, psychologically, as I always say, people feel comfortable with it and they move. So I always recommend exercising and then dieting, as doctors told us.
Okay. Again, thank you so much. Sechanze Geoffrey from Chiboga, Senfuka Mark Kennedy, Ivan Chambade, Solomon Nakato, Mr. Kamba Peter, Buembo Solomon, Agnes, and Marisa Contreras from Arizona, USA. Thank you so much for commenting and watching live. It brings us to the end of this presentation, and I believe everyone that has watched and has learned something. We can all support these mothers. We can all support our babies. From Mr. Selfcare Live, we want to thank you so much for making it every Sunday morning here to learn something about your life. We are soon starting another show on Saturday. It's called Real Life Experiences in Healthcare. We are going to be hosting people telling us what they went through in different healthcare facilities, or some of them are battling different diseases. I have a parent who wants to come and share with us what they are going through taking care of an autistic child. This guy has told me that last time I saw you talk about autism, and when they were mentioning some of the things, you kept quiet. But I want to come and share with you how, even if you're the richest person in the family, one autistic child can put you back in your place. In fact, he said, sometimes you do things and time comes and you just give up. So he wants to come and share his story taking care of an autistic child. We also have friends from the insurance companies that want to come and clear the myth, because people are saying insurance in Uganda is just like dressing up with a hospital gown. When you face the side, people think you're covered. When you turn the back, the gown is exposing all the bad. So I'm going to host people from some insurance company to come and clear and tell us actually, what do medical insurances in Uganda cover? Because people that are given comprehensive insurance go to hospitals and they are told to pay much more money than actually they think they should have paid if they were picking out of pocket. So we are going to have this every Saturday morning. So keep waiting. We shall letting you know. Again, if you're a healthcare worker that you would love to discuss something, simply write to me at chimbo80.com and then I'll be there. Lastly, if you want to run your company with us, I have close to more than 1,000 people watch every episode in 1 week. So put your business out there to 1,000 potential buyers. Simply write chimbo80@gmail.com and then we see how we we'll take you to the world. Thank you so much and have yourself a blessed morning. May God bless you, may God use you, and may God guide you in everything that you're going to do. And again, to our panelists, thank you so much for serving and loving Uganda. From me and everyone in the studio, we want to wish you a lovely Sunday. We sign out. Bye.